The pain of losing something is something that traumatizes a lot of people. The pain of losing something valuable is something that also leaves an indelible mark in the lives of so many people, and in this context, in the life of women. Imagine a woman who's been expecting a baby for X number of years, eventually gets pregnant, and because of one thing or the other, loses that pregnancy. Imagine such pain. Now, that's the reason why today on Gyna Plus, we want to focus on miscarriage and how people can cope and, of course, maybe avoid it in subsequent occasions. My name is Doris Mayim Shisha. A very good evening to you, and thank you for joining me on another interesting episode of Gyna Plus, where we get to talk about issues that affect women and girls in the society. And this program comes up every Wednesday at 6 p.m. with a repeat broadcast on Saturday at 8 p.m. And today we have a very special guest. This is someone you've never met. I mean, met in terms of being on this set, you probably would know him in person, but the first time coming on Gyna Plus set. So for me, it is a very spectacular moment. So we're going to break, and right after that, you'll meet my special guest. So stay tuned. Thank you for staying tuned. If you just joined me, this is Gyna Plus right on Africa TV, where we discuss health issues that affect women and girls in the society. And of course, my name is Doris Mayim Shishe. And like I mentioned a while ago, this program comes up every Wednesday at 6 p.m. with a repeat broadcast on Saturday at 8 p.m. And today we have someone really special who will be joining us to let us know how to cope with miscarriage and, of course, avoid it subsequently. And this is something that concerns both men and women. So it doesn't have to be whether you're a man or not. Please stay glued to your television set. So, ladies and gentlemen, joining me today is a wonderful doctor, Dr. Nnagbo Johnpaul. He is a consultant obstetrician gynecologist at the University of Nigeria Teaching Hospital, Itukozala. And of course, Dr. Johnpaul, it's good to have you on my Gyna Plus set. Welcome.
Thank you, Doris.
I mean, it's always not easy having special people on a regular days like this. So I really appreciate you finding time out of your busy moment, to be here with us. And getting into the topic of miscarriage. I mean, this is something that seems to be a bit more frequent. It's something that a lot of women have gone through or maybe experienced. And one we want to ask, what is miscarriage and what are the associated causes of miscarriage?
Yeah, thank you, Doris. I'm excited to be here today to have the opportunity to discuss what miscarriage is and the likely causes and all that. Um, Miscarriage is actually a social as well as a gynecological issue that women and essentially the families go through, most times when they go through women go through miscarriages, the families are involved, the husband, the entire family is usually involved. In fact, the society itself, is involved in it. So miscarriage is actually, in a nutshell, failure of pregnancy to continue. That is what miscarriage is. And oftentimes it comes with psychological issues, emotional issues, and above all, especially when it involves pregnancies gotten from in vitro fertilization, assisted conception, it comes with significant financial burden on the families. So I'm happy to talk about it today.
No, I mean, it's something that's a bit concerning. Like I mentioned a while ago, in the last few months, I know some women who probably, narrate their ordeals and how they've suffered miscarriages and all of that. So what do you think? I mean, what is not what you think? Because I know what is responsible, but talk to us about the causes, really.
All right. Miscarriage, as you know, it is may occur in the first trimester. It could occur in the second trimester. What I mean by that is, it could be in the first 3 months of pregnancy. It could also occur in the between 3 months to about 28 weeks of pregnancy. So in the first trimester of the first 3 months, what usually brings about miscarriage is chromosomal disorders. And chromosomal disorders are, or I say, genetic issues. More than 60% of them, of miscarriages that occur in the first trimester, are due to chromosomal disorders. It's just a way nature has, devised to rid off pregnancies that are not compatible with life at early stage. All right. Then apart from that, there are other causes such as
Let me quickly interject.
yes,
You know, when you say chromosomal disorder, it's a jargon, right? So
yes.
someone who is watching will probably hear chromosomes for the first time. Is there a simpler term that could let someone out there understand what, in a more like in a layman, term, so to speak? If there isn't, we could just continue.
Well, the way the layperson may understand is that it's an inheritable disorder, but not necessarily inheritable. Some of them may be inheritable, whereas some of them are not. But they are injuries that are sustained by genes that, transcribe how we behave, how our bodies develop, and all that. So once there is that injury in those chromosomes, and the baby that is being formed is developing, the baby will not develop properly. It could be from hormones that are produced by the placenta or the placenta itself, or even the organs, the defects in the organs of the baby during formation, that all these things develop. And because they are severe injuries, they are not compatible with life. So nature reads it off completely, finds a way to read it off. So, but once the patient do not understand all this, they will think, this is a complex issue and all that. And one striking thing about it is that it's usually a one-off thing.
Oh.
Yes. If it continues to occur, then there are more things that are causing it, such as infection. Infection is one of the causes, apart from chromosomal disorders. Infection, is one of the causes of it. Like urinary tract infection could cause it. It comes, and then the patient is having frequency of micturition. The patient is having severe, high running temperature, and then pain during micturition. So this causes the developing embryo to be in dilemma, and then jeopardizes the progress of the pregnancy. Eventually, the woman loses the pregnancy. So apart from that urinary tract infection, malaria, yes, is one major cause in our environment here. The reason is that once it comes with increased temperature, and then anemia, is one of it. Anemia is when the red blood cell is decreased, and then of course malaria is associated with anemia. Anemia is when the blood, the hemoglobin concentration is low. So that prevents supply of oxygen. It reduces supply of oxygen to the placenta and to the developing fetus. Eventually, the woman loses the pregnancy as well. So apart from that, medical conditions that are poorly controlled, like diabetes, hypertension, that are poorly controlled, and then people that indulge in alcohol. Alcohol is one of the major causes of miscarriages, cigarette smoking, and all that. Now, for second trimester, because we also have second trimester miscarriages that can also occur, defects in the shape of the uterus, are you getting me, is one of the problems. For instance, if you have uterine fibroid, especially submucous types that are very close to where the fetus or the embryo should implant, that can cause miscarriage as well. Then, if you have disfigured uterus, that could be congenital. There are some women that will have septate uterus, what you call septate uterus. Instead of the uterus becoming one cavity, you will have a muscle descending from the fundus, dividing the uterus into two. Are you getting me? That can prevent the embryo from implanting properly. And then apart from that, uniconnuate uterus, instead of the uterus becoming two, having two conua, you have two tubes, it becomes one. So such pregnancies can result in miscarriages as well. Uterus diadelphys is one of it as well, where the woman has two vagina and two uteruses. Yes, it can also result in miscarriage. Now, you also have what you call cervical incompetence. It's also one of the causes of second trimester miscarriages as well. So when you look at it generally, I'm not saying that chromosomal defects cannot also occur in second trimester, but oftentimes structural issues are the ones that are responsible for majority of second trimester miscarriage compared to first trimester miscarriage where you have chromosomal issues.
I mean,
Then most.
you've talked about quite a lot of things, Dr. John Paul,
Yeah.
and I'll take you back to the chromosomal disorders, for instance.
Okay.
And you made it really clear that it's meant to be a one-off thing. I mean, if I got
Yes,
it correctly.
usually.
Now, there are women who tend to have frequent miscarriages. They've had it like 3 times back to back. What should be done in this case? Are there usually signs to look out for? Are there symptoms? What should be done? And then you also talked about two vaginas. So I'm hearing it for the first time. I think I also like a bit of analysis, more like,
Okay.
you buttressing on that a bit more later on.
Okay.
So let's go with the chromosomal disorders and maybe possible signs to look out for. And the women who've had, frequent miscarriages like consecutively.
Yeah. Chromosomal defects are usually found in women who are younger and who are advanced in age while trying to conceive. For instance, women who are less than 20 years and those who are above 35 years. These are women who are likely, who have the high chances of developing chromosomal disorders, while they are trying to conceive. And so what we often counsel patients is, in order to avoid chromosomal having babies with chromosomal defects, it's better try to conceive when at your prime age, not too young and not too old, in order to avoid chromosomal defect. Some of them are actually de novo, can just develop. Are you getting me? Whether you are within 20 to 35 years or not, right? But we are saying that majority are those people who are above 35 and those who are younger than that. So if you wish to conceive, you are usually advised, you want to avoid chromosomal defects or frequent miscarriages because there are more, around this age bracket that I've given. So you should be able to conceive within this age bracket rather than above 35 years or less than. So, and oftentimes when we speak to patients, like some of our women, who are career women, because they want to pursue their educational careers and all that, they postpone conception till later in life and all that. We try to tell them to balance this. While you are pursuing your career, try to, achieve whatever you want to achieve with pregnancy as you go along, because it might have its own effect as well. So that's about that. Now, the advice is conceive when you are still within the active reproductive age, above 20 and less than 35.
All right. I mean, we would
Yes.
thank you so much. We'll take a short break at this point. I mean, there's so much. I don't feel like going on a break, to be honest with you. And interestingly, Dr. John Paul has a page of a channel on YouTube, so to speak, and it's called Women Health Corner. So you see all of the nuggets, all of the insight is given, something that he does in his YouTube channel. So maybe you can note it down, Women Health Corner. After now, you could follow up, subscribe, so you would always be notified whenever something comes up, because these tips do not come by on a daily basis. So we'll take a short break, and right after that, the show continues. Please do not go anywhere. We'll be right back. Thank you for staying tuned. If you just joined me, you're watching Gyneplus right here on Apia TV, and there's so much happening today. There's so much information going out, and my special guest, Dr. Nnagbo Johnpaul, is doing quite a wonderful job. By the way, we're talking about miscarriage, and if this is something you're familiar with, and you've heard quite a number of things about, women who may have experienced miscarriage, I think today is the right time for you to get the correct and accurate information how all of this happened, and maybe ways to mitigate these in future. And of course, Dr. Nnagbo Johnpaul is a consultant obstetrician gynecologist with the University of Nigeria Teaching Hospital, Itukozala. And I mean, Dr. Johnpaul, like I said before, you're doing quite a wonderful job. And you talk about quite a lot, but something that still bothers me lies in the fact that I'm a woman. I mean,
Yeah.
I've had babies, and I also had friends who've lost 1 or 2 pregnancies. But there's this general belief that once you're pregnant within the first trimester, you're not meant to, carry something really heavy. You're not meant to, if you're a seamstress, for instance, you're not meant to paddle at that time. and you're meant to avoid all level of stress. Like people who automatically sometimes go on bed rest. Does this in any way have to do with the stress level during the first trimester? Does this also lead to pregnancy loss?
Well, thank you for this question. I'm glad it's coming up because it's one of the frequent questions that patients will always, throw at you during clinic sessions. Interestingly, no study has actually established categorically that um, sewing machine or lifting of weights and all that can cause miscarriage in the first trimester. No study has established that can say, when you lift something, then you have a miscarriage, or because you lifted something, that is responsible for your miscarriage. Are you getting me? Now, most of the counseling we give to patients, it depends on the situation you find yourself. For instance, if you've been diagnosed with cervical incompetence, are you getting me? Now, you are advised that around 12 to 14 weeks, you are supposed to have cervical sacrilege. Cervical sacrilege, cervical incompetence simply means that weakness of the cervix. That means that if the ring around the cervix is weak, may not be able to hold the pregnancy until age of viability. Are you getting me? So what we often do is that we do a small surgical repair just to hold the cervix together until the pregnancy gets to viability and above. Now, if you find yourself in that situation that you have incompetent cervix, of course, we advise you not to lift heavy weight because it puts pressure on the pregnancy, on your womb, and then could facilitate pregnancy loss. Are you getting me? So any weight-bearing items, any weights at all, you are advised against that. But not that, in the first trimester, a woman gets pregnant, then you should not lift minimal weights like going to fetch water and all that. No study has established that that causes miscarriage. However, if you've been having cervical incompetence, you'll be asked not to lift weights and all that. If you were diagnosed with threatened miscarriage, there's one called threatened miscarriage. You have been diagnosed of pregnancy, but all of a sudden you start having vaginal bleeding, with low abdominal pain and all that. And when we do a scan and the baby is still alive, we counsel you to rest. Are you getting me? And we also counsel you to avoid anything that will bring about pelvic pressure, pelvic disturbances. We advise you to avoid that. Not that science has actually established that this prevents the pregnancy, the miscarriage from progressing and all that, but it's a way of psychologically treating you as well. Avoid weightlifting, avoid strenuous exercises for those who have threatened miscarriage and those who have cervical incompetence and all that. But for incomplete miscarriage, incomplete miscarriage is a situation where an individual has been diagnosed to be pregnant, but has now developed low abdominal pain associated with vaginal bleeding and passage of fleshy material, which is part of the product of conception, right? Now, if such occurs, we are no longer talking about lifting of weights or whatever. Are you getting me? The miscarriage process has already started. Therefore, it's whether you lift weights or you don't lift weights, it's immaterial at this point in time. Our concern is to ensure that you are safe, make sure that you are not losing so much blood. And then once we diagnose that it's incomplete miscarriage, we try as much as possible to counsel you and then ensure that the uterus is cleaned up by evacuation so that you won't have risk of continuous bleeding or risk of infection. So that's exactly what
there are many other questions. I have quite a number of concerns that I'm going to raise, but for this week, this is where we would draw the curtains. Dr. Nnagbo is doing a wonderful job, and I'm not letting him go just yet because this discussion has to continue. Because for women who are still expecting, how long should you try after a miscarriage? What should you do once you experience the bleeding thing? Should you be spotting, then you rush to a hospital? Next week, Dr. Nnagbo Johnpaul will be putting us through all of this. Please keep watching Ghana Plus. And of course, I've had Dr. Nnagbo Johnpaul, who is a consultant obstetrician gynecologist, University of Nigeria Teaching Hospital to Kozala. And like I mentioned before, if you want to learn more, also get more from his wealth of knowledge, you could visit his YouTube channel, Women Health Corner. He's doing quite a lot. I've been there. There's a lot that you can learn for free. So go there, subscribe, and get notified whenever anything comes up. So this is where we draw the curtains for this week, Dr. Nnagbo Johnpaul. Thank you so much. We will continue again because the discussion is just, starting. See you next week.